Sorry. So this is our first time doing a hybrid version of our CASA coffee. So please bear with us because we don't know what we're doing. Trying to figure it out. But I think we're good. And we've got a lot of people joining us on Zoom this morning. So good morning. And thank you for joining us virtually. And thank you all for joining us in person today. I'm really excited to just be in a space together with our community again. It was, CASA Coffees, I felt like we're getting a lot of great momentum last year. And for obvious reasons, we had to shut it down. But we are really grateful to Laspezia. This is a example of ask and you shall receive. So we just came and we said, can we use the tent for the morning? And they said, of course, no problem. So who knows, maybe we'll do this again if the weather, stays mild. And it's certainly mild today. So thank you, welcome. If you don't know me, I'm Allison Camardella. I'm the president of North Shore CASA. We have a lot of our fabulous board members here. We have Kevin McGilloway, who's the vice president. Steph Papiro is on the board. Tanaz Baluch is on the board. And thanks for everybody for being here. To reconnect, I think our message today, what we've been learning over the last few months, based on surveys that are done in the school. And I'm not going to bore you with stats today, especially because I forgot my notes at home. But the overall message is our kids are drinking. They're starting too young. They're drinking too much. Binge drinking is well above national norms. Kids drinking by senior year is, I think, double national norms. They're starting under the age of 15. Those that report drinking by senior year, the average age of onset is under 15 years old. And also, most importantly, but which goes hand in hand, is that our students' depressive symptoms are up and on the rise from past surveys. So, there's a lot to tackle there. And these surveys were given prior to the COVID shutdown. So, we're just very aware of what are our kids feeling? How are they handling all of this? And then what are the coping skills that they have to deal with those feelings? And very often, a substance is an easy way to handle feelings that you're not comfortable with. And we know this from a lot of research. So we wanted to launch our CASA Coffees this year, talking about how our kids are doing, how to check in on them to see if they're doing okay, how to, find, what am I looking for? What are, and how to use the coping skills to get through tough times, So that is why we brought in Dr. Jolie Silva today, and she's going to speak to us on detecting, that was the word I was looking, detecting the problems that they may have. So in the meantime, we are CASA. We are here to help your children. We're here to make a difference. We want to help reduce access to alcohol for our youth. We want to get the binge drinking numbers down, and we want to get those depressive symptoms down. So everything that we're doing this year, most of the themes that we're focusing on this year will focus on those three areas. Specifically, if you do have high school age children, we are working on something right now called Project Sticker Shock, which is, we've already got a number of volunteers, and the North Shore School District has helped us to find some great junior and senior high school volunteers. And we're going to be going around to local businesses that provide alcohol, that sell alcohol. And the kids are going to create a campaign with a sticker that reminds parents and adults not to share with anybody under the age of 21. And the kids will go in and put those stickers all over bottles and cases, all over these retail stores. And we hope that will be effective messaging to remind people, what the actual law is and what the penalties are. So up here, before you go today, please just take a look around. We have our membership forms. If you're not getting our regular emails, if you're not getting our quarterly newsletter, the best way to stay in touch with CASA is just to give us your email, become a member, and you'll never miss an announcement. So please do that before you go. We'll always take donations. This is a free event. We're happy to keep it that way. But, we are a 501c3 organization. And we, if you want donate. Steph has a credit card swiper all set up for you. And we have information on substances, our parent pledge, which is to pledge not to serve underage kids in your home, any substances. There's a lot of great information. And if nothing else, take a bumper sticker and slap it on your car. So with that, I've spoken enough. I want to introduce Dr. Jolie Silva, who is a clinical psychologist and clinical director of her practice in New York Behavioral Health. She has over a decade of clinical practice working with children, adolescents, and adults. And I know she's got a lot of great information to share with us today. Thank you, Dr. Silva.
Thank you. Can everybody hear me if I keep my mask on, or should I take it off? Yeah? I'll leave it on, and then if you can't hear me, I'll take it off. Okay, so sure. Okay. So what the topic today is, it's a big topic, and I could probably talk for 14 hours about it. So I'm going to try to make the best use of 30 minutes as I can. And then afterward, if there are questions, I'm happy to take them. And I can also do a little bit of practical exercises with you if you think that stuff would be helpful. But just in terms of my history, well, first of all, I'm new to the district, so I'm happy to be part of the district. I have a kindergartner as my oldest. So I'm happy to enter into North Shore District, and I'm happy to be here. I'm happy I was asked to contribute in this way. And I have worked with children, adolescents, and families for probably like 10, 15 years now in private practice. And I've also have a history of working in schools as a school psychologist. I'm actually going to take this off because it's like, I don't know how the teachers are doing it. Oh my God. You like suck in your own air, especially when you're trying to project. So I have about, like I said, 10, 15 years of working with children, adolescents, and adults in private practice, and also doing a lot of psychological evaluations on kids. And, you know, we talk about here recognizing signs of emotional distress, and then how to successfully use coping skills to help. So I wanted to just start out by the newsletter Allison was referencing. If any of you have a chance to read it, I'm not going to go over all the stats with you. I don't even have them all in front of me, but it was like really, really eye-opening to me, and very troubling to see some of these numbers. So one of the numbers I want to focus on is the depression piece that she mentioned, because that's my area. And just two of the stats that I wanted to bring up were 58% of 10th graders are reporting depressive symptoms. 58% in this district. That's really high. And then 44% of 12th graders are reporting depressive symptoms. One other thing I wanted to mention is that the suicide rates have really significantly increased. I had to talk on this maybe like a year ago, or maybe it was 2 years ago. 2020 is like in my head, not even a year. So I don't even remember when this data was compiled. But the World Health Organization, there's one suicide death every 20 seconds in this country, and one attempt every 1 to 2 seconds, right? So the suicide rates are up 24% from 1999 to 2014. And I realize we're past 2014 now, with the highest increase 2006 to 2014. Now, I haven't looked into what the hypotheses are for why there was such a drastic increase from 2006 to 2014. But one of my own hypotheses is the increased use in social media, which is a separate issue, which I'm not going to have time to get into all of that now. But I do think it's a contributing factor to some of the anxiety and depressive symptoms we're seeing in middle schoolers and high schoolers. And the other one thing I wanted to just point out is that with regard to suicide rates, over half of them don't have a known mental health disorder. So you think things are fine, right? Over half of them don't even have a known one, which means that they haven't been to a mental health provider to get a diagnosis. They likely have one, but it's just not diagnosed. So I just wanted to start with that so that we can talk about how to recognize signs And I'm going to keep looking at my watch because I want to make sure that I'm not spending too much time in the beginning of the stuff I have to say. So in my field, there's a difference between signs and symptoms. Does anyone know the difference between a sign and a symptom when you're talking about mental health or the medical field? So a symptom is something that you experience internally that externally people don't necessarily know is happening. So if I have a sore throat, that's a symptom. You don't know that I have a sore throat. Okay, so if I have depression, you might not know that I have depression. It's a symptom, right? A sign is what is obvious to everybody else. So if I'm like sitting here and start starting breathing heavy, right, and I start getting a panic, that would be a sign that I have anxiety. But I might be feeling anxiety and sign as a symptom, but people don't necessarily know that I have that. So I wanted to point out that difference because you can have symptoms of a mental health disorder, but not necessarily show signs to people around you. And I'm talking to parents and teachers and school professionals because it might not be so obvious, I guess is what I'm trying to say. And when I read the stat that over half of them don't have a known mental health disorder, I say, well, they likely had symptoms, or maybe they did have some signs, but they're not so easy to pick up, right? So I'm just going to give an overview of some signs that just to make you a little bit more aware of some of the signs that might be overlooked. And, you know, we talk about ages are totally different, right? I have a 3-year-old and a 5-year-old. The signs for a 3-year-old and a 5-year-old are not like the signs for a 17-year-old. And since this is a CASA event, I'm going to focus a little bit more on middle school and high school because that's where the problem starts, and it is starting way too young. So it's tough. And when you talk about adolescence and the development of the adolescent brain, by the way, the adolescent brain develops until age 26, not age 18, 16, 26. Okay, so when we think that you're an adult at 18 or 21, that is, and of course there's variation, right? Like some kids might mature a little sooner, some might mature a little later, but on average, the brain is developing at that pace until age 26. So in terms of depression, a specific sign you want to look for is isolation. Now, well, my kids isolate all the time. They're in their room on their iPad all day long. I mean, that's just what they do. I totally get that's just what they do and that's what they want to do. Because by the way, when you talk about adolescence, peers are number one. Like we want to think we're number one, but peers are number one and families number two. So if they want to isolate in their bedroom and talk to their friends, that is totally normal. That is normal. Especially now with the pandemic. Like I could spend a whole hour or more just talking about what has happened in 2020 in terms of isolation and tablets and phones and depression and anxiety, which is things have been on the rise even more right this year. So isolation, yes, but I think it's important to recognize is my child doing more of that than other kids his age, right? And is there more isolation than maybe peers, like talking to other moms? And I always want to say right from the outset, if you have any concerns, you should 100% reach out for a mental health, even just a consultation. It doesn't have to be, oh, I'm going into therapy and I have to do this like for years every day. No, you go in, you sit for 45 minutes, you talk to somebody like me or any other mental health professional, and you get some feedback on it. Because you don't want to be like, is that depression? Is that anxiety? What is it? Just go talk to somebody who knows the signs and symptoms of it. So when I talk about isolation, you want to see, is it significantly deviated from what is normal, what the other kids are doing at that age? You want to look at affect. So in the mental health field, we talked about the word affect, which is which is a sign, right? When I talk about signs and symptoms, affect is the way you're presenting to the outside world. So signs of depression as a parent would be, besides the isolation, would be seeming like lethargic, could be one of them. Heavy, right? And feeling like your kid just seems heavy, right? And low motivation, possibly. Anhedonia is a symptom of depression, which is the inability to experience pleasure with activities where you used to experience pleasure. So let's say your kid loves going apple picking, like that was the thing. And then, and you go apple picking, and it's like, like taking the, like, doesn't really seem to enjoy it. And like, as parents or as educators, you can tell when there's not much enjoyment. So that is like a hallmark symptom of depression, which is the inability to experience pleasure for things that you used to experience pleasure. Another big one that I want to make sure I point out to for adolescents specifically. So a symptom of depression for adolescents that is not a symptom of depression for adults is irritability. And parents say to me, they're teenagers. No, I was one, and sometimes I think I still am one because I get irritable all the time. That's why I say you got to consult with somebody, because there's this normal teenage attitude, right? But there's a little bit of a difference between a normal teenage grumpiness and the irritability when there are other signs of depression in addition to the irritability. So irritability is a big one for adolescents. And a lot of times parents will say, well, they just have an attitude, or they're just angry and they're not doing what I want. And many times it's just a symptom of depression. So that's one that often goes missed by parents. I didn't jot down the symptoms. I'm just trying to think of some. Depression, I would say the isolation, the irritability, the heaviness, sleep problems can be hypersomnia or insomnia. Hypersomnia is sleeping too much, and it's often for depression a way to avoid feeling depressed. So napping a lot, again, teenagers, like they might nap. That's why some of this stuff, you have to look at the whole picture, right? And insomnia is either difficulty falling asleep, nocturnal waking, which is waking in the middle of the night, or early rising, waking up super early and not being able to fall back. And hypersomnia is sleeping extensive periods of time or napping. And while I'm on that sleep issue, I'm just going to do a little caveat on sleep, because I just think sleep is so important. I call it vitamin sleep, because I just think I've called it that my whole life. And people who know me know that I just love sleep. And I want my kids to sleep, and I want everyone to sleep all the time. And especially in adolescence, because the brain does not develop the same way if you're sleep deprived. It's like, so these kids, 2020 doesn't count. These kids come into my practice, half asleep, walking into the waiting room. What time did you get up? 6. What time did you go to bed last night? 1. What'd you do after school? I had football. I had to do 14 hours of homework, and then I was on FaceTime. Okay, and I'm depressed. Sleep is the first thing we got to work on, okay? Because it's a vulnerability factor, and research shows that if you're sleep deprived, you're increased risk for all these kinds of things. So, believe it or not, teenagers. So there's a bell curve, and I explained this the other night to a couple of friends of mine when I was accused of sleeping too much as an adult. There is a bell curve when it comes to sleep. People say, oh, we all need 8 hours of sleep. We don't all need 8 hours of sleep. The bulk of adults function optimally on 7-8 hours of sleep, okay? There are some people who are outliers who require a little bit more sleep, like 9 to 10. I don't get any of it. So if I pass that on the table, don't judge. 9 to 10 hours of sleep. There are some people who function optimally on 4 to 5 hours of sleep, okay? Teenagers require, just for optimal functioning and for their brains to develop normally, 9 to 10 hours. Now, if they're on that same bell curve, some of them might need 12, some of them might need 8. Okay, so no one requires more sleep except for newborn babies than adolescents, and they're all getting like 6-7 hours sleep. Number one, big problem. I don't know where that whole movement went with starting school later. I remember reading about it in the Times when I used to have time to read the Times. I don't have time anymore, but there was a big movement on starting the school day later. I don't know where this district stands on that. I know it's an issue because there were sports after school, but teenagers are just not getting enough sleep. So I just had to give that as my little preach on that one. So if they're hypersomnia, it might be because they're sleep deprived, I guess is what I'm saying too. It doesn't mean that they're depressed necessarily, they're tired. Okay, so I want to make sure I get to some coping skills. But before I do that, I need to talk about something really important since we're talking about substance abuse here. And it's the concept that we call experiential avoidance. And it is exactly what it sounds like. It is, I experience something and I want to avoid it. Okay, this is like the main issue in terms of mental health. There are many psychologists and professionals in the field who argue that if it was not for experiential avoidance, we would have no mental health disorders like depression and anxiety. Things like schizophrenia and biological is a different ballgame. But experiential avoidance underlies all depression and anxiety and anything. Like, it doesn't even have to be clinical, it could be subclinical. And let me tell you what it means. It means I am uncomfortable and I do something to avoid it. I mean, we do that every day, all the time. We function like that as human beings. There's nothing wrong with anxiety. There's nothing wrong with feeling sad. There's nothing wrong with feeling guilt. There are 10 basic human emotions and all of them are fine. What we want is to be able to tolerate them, okay? It's okay if I'm feeling nervous. It's okay if I'm feeling anxious. But the running from it, the avoidance of it, is the exact thing that perpetuates it and leads to these rises in numbers. So I'm going to leave it there because it's a huge topic. But when you talk about substance use, there's peer influence, okay, which I said peers are number one, okay. There lacks parental boundaries and rules and guidance. And then there might be, for a bulk of them, experiential avoidance. I don't feel well. I looked on Facebook. I'm sorry, Facebook dates me. I think we're on Snapchat, Instagram, and TikTok now. I don't like to date myself in front of my clients because they think I'm an old lady then. So I see my friends had a get together without me. And I'm a 14-year-old girl. That doesn't go over well. I feel I feel anxious. I feel depressed. Nobody likes me. They think I'm this. They think I'm that. I feel a negative feeling or distress, and I go out and I'm sad and I drink to avoid the negative feeling. Experiential avoidance. Okay, so there's peer influence. There's lack of parental involvement. There's lacks parental boundaries. I'll put it that way. And there is experiential avoidance for some of them, right? I feel uncomfortable and I want to not feel uncomfortable anymore. So, and it's a big problem. It's a really big problem. And the parent boundaries is a big one, which I can get into that if we have time. But I want to go over coping strategies because I want to make sure I'm getting to that. So, okay. So coping skills. You're not going to be able to walk away from this and have like all of these coping skills that you're going to be able to use. There's not enough time for it. But I can give you some tidbits. And of course, if anyone ever wants to reach out to me, I have absolutely no issue with that. I am happy and welcome anybody to email or ask questions about anything we're talking about. So the first thing I wrote down when I was just like jotting down some of the points I wanted to hit, before I go over specific coping strategies, I want, if you go away with nothing else, I want you to go away with this. Give your children the opportunity to cope on their own. Give them the opportunity. Stop saving them. I mean, there are caveats to that. If they fall, allow them to get up and clean off their own. I don't mean this, I'm just using that as an example. To clean off their own wound so that they know how to put on a Band-Aid when they're 21. Because I have a caseload of college students who are having a hard time functioning because they don't have the skills. So my first thing is, we have to recognize ourselves, I think, as parents and adults, and when we see our kids suffering, I mean, we suffer more or the same, but it doesn't feel good, right? So what I see a lot in my practice is that parents become so uncomfortable when they see their child under distress that they practice their own experiential avoidance by helping the kid. And I use the word helping loosely, like there are a lot of things going on, helping the kid. And then their distress goes down and the kid's distress goes down. And now we're all good. But the problem is now they're 20 and they don't know how to work through those things. It's my hypothesis on this because I just am seeing it like more and more in my practice. And I realize I haven't been doing this for 30 years, but it just seems to be like a big problem where there's a little bit too much rescuing, I would say. So we have to teach them how to cope with things on their own. So some of the things we can do, and I'm big on this, I'm really big on this, is validation. And validation is, as a parent, and even like with your spouse, with your friends, like all over the place. Validation means you are telling the person it is okay to feel what they feel and being supportive of that feeling. It doesn't mean you agree with the feeling. So validation does not equal agreement. It means it's okay to feel that way. So what I see all the time, and I catch myself doing it sometimes. I mean, this is not easy stuff. Don't think I'm like doing all of this at home and have like this like perfect thing going on. This is not easy. The validation is when your kid is crying and you say, you don't need to cry, it's okay. That is invalidating, even though you're trying so hard to like console and help. It is actually invalidating. So and it's like it's such a easy thing to do, right? Or if a kid is anxious about taking the test, you don't need to be anxious. You're so smart. Why are you anxious, right? Or if they're angry, it's easy to knock down the anger emotion because it affects us so much. Or if they're even when they're like sad, like you don't need to. Why are you sad? And sometimes it can even get a little more aggressive than that. Just in terms of telling people that what they're feeling, they shouldn't be feeling. So that the validation is huge, and that might be one of the biggest things too that I think is really important. And it's really hard sometimes if you don't agree with what somebody else is thinking or feeling. It is very hard to suck it up and validate, because in your heart you might be like, you are just so. I mean, even with like the teenager, like you are just. But they're feeling it for a reason. And something we say in one of my favorite therapies called DBT is everybody is doing the best they can at any given moment. And that is true, right? With whatever resources you have, if somebody cuts me off and I do something back, I am doing the best I can with the resources I have in that moment. And you have to all tell yourselves that about you And you have to say to your kids, they're doing the best they can. My 3-year-old is throwing stuff. He's doing the best he can. His brain is this big, right? And by the way, the 15-year-old, their brain is like that big too. Like, their brain is not developed. The teenagers' brains are just not developed. Okay, so want me to maybe I'll do a couple of like deep breathing exercises just so you have like something to take home with you. The other big thing I wanted to talk about that I don't have time to talk about is collaborative problem solving, which is, and this is used clinically mostly for real oppositional kids, but I use it all the time anyway in my practice and even at home. It's when there's an issue, like when you're at an impasse with your kid, brush your teeth, no, brush your teeth, no. I mean, I'm still with the little one, so I'm still talking about teeth brushing. Brush your teeth, no, brush your teeth, no. But that's still an issue sometimes with 15-year-olds. When everybody's happy and everybody's in a good mood, you sit down and you say, and the way the researchers and the writers of this always use the same phrase, I don't do it this way, but they like you to say, I notice sometimes when you don't brush your teeth, when I ask you to brush your teeth, you don't want to. What's up with that? Like they want you to say, what's up with that? But I don't say that. I usually just try to work it out together. And they said, and I did this, right? And my daughter said, the toothbrush hurts my teeth, Mommy. I said, oh. She's like, I can't, it just hurts my teeth. And then I looked at the brush and I noticed the bristles were all like, I needed to change the tip on the Sonicare. And I changed the tip. And this is a simple example. It doesn't always work this easily, but here's a perfect example. We like collaboratively problem solved an issue. When they get older, it's a lot harder, right? Especially if they're explosive and have major things going on. So you sit down and you work it out at a different time, not when the issue is happening, separate from that. So a couple of anxiety coping skills I can do with you right now, if anyone thinks that would be helpful. Another thing that I didn't even touch on, which is my major area, is mindfulness-based interventions. I wrote my dissertation on mindfulness in 2006, and I had to fight to write it because none of the professors said this is, leotard stuff and this is, I was totally up against it, but I fought for it and I did. And there was no research on it back then. I had my lit review was like this big on the mindfulness stuff. And now if I say the word, everyone probably knows what it is, right? So there are 1,000 studies a year right now being conducted in mindfulness literature. And I don't keep up on it all because I don't have time, but I try to a little bit. So I didn't even get into mindfulness, which is my absolute favorite topic. And I'm not going to have time to, but I'm going to teach you some deep breathing techniques. And if you're interested in mindfulness, you can always reach out to me because I'm happy to talk about that some more. I was running, we have an office in Manhattan, in Rockville Center, and in Old Brookville. And behind Bottle Buy, that building behind Bottle Buy is where we just opened up that one. And the Rockville Center office, I used to do mindful mama groups for free, just because I love doing it. And it was great because we come in and we have 15 minutes because mamas are busy and we don't have time. So if I ever get any of those going up around here, I don't send out something somewhere. I don't even know. Oh, yeah, something. Okay. So one anxiety technique I'm going to teach you is called paced respiration, and it's awesome. And it works for like 99% of people, or in the high 90s, maybe not 99. If you do it right now and you find it doesn't work for you, then it doesn't work for you. But in all my years doing this, I've had like 2 clients that they were like, this doesn't work for me. So it'll probably work. So it's a physiological exercise that works on your blood vessels to elicit a calming physical response in your body. So it's good to do when you're actually feeling nervous. It helps calm you down. And you can do it also just daily, like every morning when you wake up. And it's called paced respiration. And I'll count you through it. You breathe in for 4 seconds through your nose. You hold your breath for 7 seconds. And then you slowly breathe out through pursed lips for 8 seconds. The key is that the out breath has to be longer than the in breath. So sometimes I'll do it with people and they're like, I could breathe out for longer. I'm like, so breathe out for 10 seconds. Like, it doesn't have to be exact. It just has to be, the out has to be longer than the in. And just a couple of common errors I see when I first do it. It's got to be diaphragmatic breathing. So if you sit right now like this and just breathe, just notice what breathes more, your belly or your chest. After all these years, I still don't do it right. My chest, your belly's supposed to breathe more. Oh, I do it. I'm like, my chest is still breathing more. Your belly's supposed to breathe more. You want to breathe from your diaphragm. That's the healthiest way to breathe. And all Sam's stuff. And don't tell him.
He's watching.
So when we do this, we want to put both hands on the belly, and it's best to do it with slouching back or lying down. So you just don't want to be like compressing the lungs when you do it. So we're going to breathe in for 4. And another common error I see is people breathe too quickly. So I'll count out 8 and they'll be like, I have no breath. You gotta like span it across the seconds, okay? So like slowly breathe it out. All right, so okay, everybody just breathe out your air and put your hands on your belly. And I'm gonna count you to 3 in a row, okay? Slowly breathe in through your nose. 1, 2, 3, 4. Hold your breath. 1, 2, 3, 4, 5, 6, 7. Slowly out. 1, 2, 3, 4, 5, 6, 7, 8. In. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7. Hold. 1, 2, 3, 4, 5, 6, 7, 8. Okay, open your eyes, everybody. I did too. Did I breathe out? 8. I think I lost my.
You got it.
I think I was like, did I just say? You get it. In 4, hold 7, out 8. I was to be honest with you, I saw my own reflection on the Zoom from the side. I'm not gonna lie, and I'm like, my hair looks horrible. I'm not even joking. That's exactly what just happened. Blew it out this morning for what? Okay, so I have more coping skills, but I'm not going to give them to you because I want to see if anyone has questions, and I could always, because I talked a half hour. So I want to see if people have questions, but if we don't have a lot of questions, I am happy to do a couple of more of those kinds of exercises with you, or do